Thank you very much, and thank you very much for the CAA for the opportunity to come and speak with you today. Always a tough gig before lunch, but I will try and make sure we get to lunch on time. I'd also like to really acknowledge that whilst we're doing GoodSAM here in Victoria, that WA have developed and implemented their app and their community responder app, and it's also something, credit to Bridget and her team in New Zealand, that's been really successfully rolled out right across the country as well. So it takes a system to save a life. The Global Resuscitation Alliance have spoken about that over the last few days, and those of us that were lucky enough to listen to Dr. Kudenchuk, Anne Dole and the team from the Resuscitation Academy and the 10 steps and the 10 programs that are used. And it's a component of what we do in Victoria. Step 7, talking about the use of smartphone technology, and you'll see there is a whole lot of other work that also goes into improving cardiac arrest survival in the out-of-hospital setting. What I'd like to do first, though, is introduce you to Keith Young. Keith was our first survivor from out-of-hospital cardiac arrest that we've attributed to the GoodSAM program, and just take a moment for...
the carving knife in my hand, and then it just went black.
It's a 55-year-old male who's passed out, is that correct? Yes, and he has a heart condition. Okay, ma'am, just continue with the pump and the mouth until the paramedics take over. Okay, I've got an off-duty paramedic here.
It was probably another 30 seconds to a minute that Darren walked in.
Time went so fast, and this man ran in, and I went, "Oh my God, who are you?"
And who was he? Let's go back to the beginning. Our call to action, the chain of survival, something that we're all very, very familiar with. When we have a look at our data, and this comes from 2016-17, Karen Smith, Kylie Dyson and the team from VACA, 95% of the first calls in cardiac arrest in Victoria are going to ambulance services. At the point of call, we're correctly identifying cardiac arrest 86% of the time. 61% of those patients are getting bystander CPR. That's good, but you can see there's starting to be a little bit of a drop-off. This next one is really key. 4%. 4% of our patients are getting defibrillation prior to ambulance arrival. Our average time to defibrillation in Victoria is 9.2 minutes, which is closely associated with our response time, sitting at about 7.7 minutes on average. And 26% of the patients are surviving the event, surviving to hospital. That's 11% of all patients, 11% of all treated patients are discharged, and the Udstein survival rate is 37%. But what that really highlights, I think, and not just me, but Charles Deacon did this fantastic piece of work on the rethinking the chain of survival, is that not all the links are created equally. The more that we can invest and the more that we can put into these first links in the chain of survival, the more significant impact we can have on survival from out-of-hospital cardiac arrest. So what is GoodSAM? It's an integration piece. We know where cardiac arrest is occurring. We have a fantastic 000 network that's identifying that for us. We know where there are defibrillators within the community. We've invested a lot of money and time trying to record all of that information, and we know there are people within the community that are trained, trusted, have the knowledge and skills available to provide that life-saving CPR. So it's about getting the person who knows what to do with the life-saving device to the patient that needs it. And what we've really found partnering with GoodSAM, being a medical company that's doing some great tech as opposed to a tech company that's doing something medical, is that they are really invested in the mission to improve out-of-hospital cardiac arrest survival rates, and that goes through everything that they do. So how does it work? Once the 000 call's received, and we, like the rest of Australia, use the ProQA structured questioning call-taking process. Once cardiac arrest is identified and the AMPDS determinant comes out, the call is instructed in CPR, so that telephone CPR, emergency service dispatch happens, and the GoodSAM system is activated in the background. And what that does in Victoria, it alerts within 400 metres in the urban area and then out to 5 kilometres in more regional and remote areas, up to 3 responders who have the opportunity to accept or reject the alert, and we'll provide them information about where their closest AED is, where the patient is, so they can get that device and go to the patient. So just talking for a moment on the event selection methodology, so the AMPDS determinants that we utilised. When we were going through this, again, we used the data from Karen Smith and her team out of the VACAR report, and we were looking for case types that had a high accuracy for cardiac arrest, a high likelihood of attempted resuscitation by paramedics, so we wanted to minimise exposure to those futile resuscitation attempts. We obviously wanted to maximise the number of cardiac arrests that are captured by the program, maximising its impact, but also minimising exposure to scene safety, the scene safety issues, occupational violence, those types of things, and those events that we know that are highly traumatic or stressful, recognising that any cardiac arrest can be potentially both highly traumatic or stressful. And what we came out with are those 6 AMPDS event types there, which collectively represent about 80% of the cardiac arrests we attend as an organisation each year. One of the other great things about GoodSAM is the governance framework in which it exists, and we've put together in consultation with GoodSAM, and we've also borrowed from New Zealand here as well, the Code of Conduct, which covers such things as expected behaviours, alcohol, other drugs, driving, the scope of practice that we expect people to perform at, as well as handing over to the Statutory Ambulance Authority once they arrive. As I mentioned, we do have an automated workflow, and what that really means, having it integrated within our dispatch workflows, is it doesn't add any additional steps for the call taker or the dispatcher, but it's also very quick, and it's automatic. So if a case is upgraded to cardiac arrest, the GoodSAM alert is generated at that point of upgrade. Equally, if further information indicates the case should be downgraded, the GoodSAM alert is cancelled. One of the unique things that we've done in Victoria is implemented some exclusion criteria, and these are 1900 words and phrases that we've looked back over historical data and identified instances where it would have been inappropriate to send a member of the community. And these focus on things such as inappropriate locations, controlled facilities like police stations, prisons, health facilities like nursing homes, GP clinics, where it would just not be appropriate to have a member of the community knocking on the door. Inappropriate patients, where information from the 000 caller suggests that the patient has a not for resuscitation, is palliated or has some form of advanced care directive. And the scene safety and occupational violence. So where there's information from the caller that suggests drug and alcohol, mental health, agitation on scene, again, those types of cases where our paramedics are potentially going to be rendezvousing with police, we're not going to send a community responder into those. The other thing that's really important to us in integrating it into a system of care is our post-event care. So looking after our people. We undertake telephone-based follow-up with our responders, similar to how Trevor was talking earlier with the EMR program and the firefighters. Our paramedic educators will do a telephone-based follow-up for 3 reasons. Firstly, thank you. These are people that have gone out of their way, taken time out of their day to provide some life-saving care. Any questions, because often we do find that they have clinical-based questions, things that are mulling around that they just need some basic reassurance and answers to. But thirdly, are you okay? And if the answer to that is no, or they're not sure, we can link them in with community-based support. Also important in having a connected health system is integrating the data that's on those machines. So having a connected system right from the point of call through to the advanced care that's provided at hospital. And the data that exists on the public AEDs is part of that, particularly where we have some great, fantastic early CPR and early defibrillation and potentially ROSC prior to ambulance arrival. The information that's on those machines can be incredibly valuable to the patient pathway through the hospital system. So as part of integrating into the system of care, we undertake a data retrieval, get it to the hospital, and we also recommission the AED, so reducing those financial barriers to AED ownership and inclusion. The partnerships are really key, absolutely key to everything we do here. We have 2 categories of GoodSAM responder we utilise within Victoria: the APRA registered health professionals, so doctors, nurses, chiropractors, all of the APRA registered professionals, and our partner agencies, which you can see on the screen there. And those are some of the most iconic organisations that Victorians are used to turning to in times of need. And what that provides, as we were introducing GoodSAM, is a really powerful image of organisations that people are familiar turning to, and even though they're out of uniform, you know that the person turning up on your doorstep is someone that is trained and trusted. The communications approach has been really critical to the implementation of GoodSAM in Victoria. And for those that were lucky enough to attend the Resuscitation Academy earlier in the week, David Lacombe from RQI Partners, I think, had it really well articulated. If you don't get the communication right, you're going to have one of the best solutions out there, but nobody is going to know about it. And we've come at this using a three-phase approach. Our AED registration, so attempting to find all the AEDs that are out there. There are over 15,000 AEDs estimated to be across Victoria. Currently we know where about 5,000 of those are. So there's a lot of work to be done there. The responder recruitment, so engaging with our responders and our workforce, encouraging the workforce to participate and have uptake in the program, and trying to have 4,500 paramedics having 4,500 positive conversations about GoodSAM and what community response can do to cardiac arrest survival. And finally, the public launch. We were very lucky in Victoria, and we had the Premier and Health Minister join us, along with 3 survivors from out-of-hospital cardiac arrest. And what really tied all of these messages together were the patient stories, the survivor stories, and it's those stories that people really relate to. We've heard from Keith. The image on your right there is Dr. Crellin, who's had a cardiac arrest in Ballarat, so one of our regional centres within Victoria. He's a physician within that community and had a cardiac arrest it was about 4 o'clock one morning. His wife heard him collapse, called 000, and one of our off-duty paramedics, Jess, who's also in the photo there, was nearby and rushed down to the scene. And she's been described by Dr. Crellin as his angel in pyjamas. There's been a few GoodSAM responders that have turned out in pyjamas now, but I think it just really underlines the power of the story and using those patient stories. And I'm just going to show you a short video now, an example of how we use these stories.
I walked around the gym for a little bit.
I was playing soccer.
My legs just gave out from under me.
I felt really dizzy.
And collapsed.
I was unresponsive.
And I had no pulse.
I had a cardiac arrest.
Luckily, a couple of my teammates knew what to do.
Someone got a defib.
The guy started CPR.
The defibrillator restarted my heart.
When someone is in cardiac arrest, every second counts. The sooner somebody receives CPR and defibrillation, the greater their chance of survival. Saving lives is always a team effort. That's why we've partnered with GoodSAM. It's an app that alerts off-duty professionals like you to cardiac arrests nearby. If you're a medical professional or qualified first aider, please join us. Register as a trusted GoodSAM responder today.
If those guys hadn't been there, or if they hadn't been able to get a defib, I wouldn't have survived.
And that's just one example of how you can use patient stories to really drive recruitment. And I'd like to pay credit to Lauren, who featured in the video and who's also here with us today. So early results out of the program, and these are unpublished internal data, is that we have had 860 additional defibs registered over the time that we've been working through this. And that's about a 25% increase on where we were previously, so that's really significant, but there is still a long way to go. We heard Freddie Lippert talk about the Denmark experience earlier today and yesterday. 17,000 AEDs across Denmark. We think there's a similar number across Victoria, as I say. We've had 33% of the AV workforce sign up, or the operational workforce, so 1 in 3 of our paramedics, which when you think about trying to get paramedics to do something voluntarily, that's incredible. That is incredible. So still working on that space. 3,500 volunteers from across the state, so that's our paramedics as well as our partner agencies and health professionals, and that's growing on a daily basis. And the media coverage, 110 million people saw, tweeted, viewed, interacted with a piece about GoodSAM during the launch phase, and that is just phenomenal for a state of 5.5 million people. So it is already making a difference in Victoria. We have 20 GoodSAM alerts every day go through the system on average. Since we started in pilot back in January, we have 860 people that have been notified of someone nearby that's in probable cardiac arrest. And in about 20% of cases, we've had that person being able to go down and start providing some life-saving care. So 41 instances of care that have come out of that as well. And I think what really underlines the power of GoodSAM being an international platform as well is just having been in New Zealand in the last couple of days, we've had 2 GoodSAM alerts within the Victorian contingent to New Zealand patients that have been in suspected cardiac arrest. So, I mean, the power of having something like that that's crossing international borders is just phenomenal. So where are we going into the future? Is it drones? Who knows? The AEDs, so look at the work that Bridget has done and she's spoken about over the last couple of days. Are the AEDs, are they located in the right places? Are they distributed across areas of socio-economic inequality? We know that 76% of cardiac arrest is occurring in the private home. Anecdotally, we would say that 90% of our public AEDs are in places of public gathering. Are there other AED delivery models that we should be looking at? Taxis, Dominoes, drones, dog robots. The other piece around video streaming. GoodSAM has this functionality and we're not currently using it in Victoria, but there's certainly possibilities there in terms of secondary triage, being able to see the patient that you're attempting to triage, major incident management, identifying patients that are in cardiac arrest and supporting those early responders in the provision of CPR. There's certainly a lot of opportunity in that space. So I think in closing, GoodSAM gives us the opportunity to dynamically crowdsource CPR, but it is how we publish that, how we publicise it and how we integrate it into our system of care that is really key. Thank you.